Hello everyone, I'm Natalie Kunzman, MD, and today we're going to dive into ulcerative colitis, Crohn's disease, and inflammatory bowel disease. Now, symptoms of these conditions can be very mild to very severe, and the symptoms may also vary based upon the diseased sections of the bowel. A lot of these conditions can be in several sections of the GI tract, but notoriously so, ulcerative colitis typically will start at the rectal distribution and as getting worse or progressive may migrate up the sigmoid colon. Crohn's disease, on the other hand, can affect anywhere from the small bowel to different sections of the colon and can be in patchy areas or large sections with skipped areas. And inflammatory bowel disease will encapsulate other different types of colitis and small bowel disease. Now, some of the obvious symptoms with these conditions involve the bowel-related symptoms, such as loss of appetite, severe cramps, persistent diarrhea, sometimes fevers, rectal bleeding, an urgency or a fecal urgency, which is a painful condition with an urgent need to evacuate. This can also be associated with weight loss, fatigue, and night sweats. Now, the not so obvious symptoms associated with this are the trickle-down effects, which may include acne and rosacea, other skin eruptions, brain fog, irregular menses or periods with women, brain fog, agitation, and mood disturbances. And the reason these conditions may occur is the trickle-down effect from the severely affected leaky gut in the inflamed areas. Now, in functional medicine, which is what I do, all factors are considered to not only help diagnose and come up with the etiology, but also to treat. So that not only includes the genetics, but also the environment. And the environment is particularly important when it comes to either deficiencies or toxicities. Then, of course, we have the psychosocial involvement, the energetic contribution, and maybe even some infectious triggers. So thus far, we know that there are higher rates of the inflammatory bowel disease in our northern and industrialized countries, which includes us here in the U.S. Interestingly, Minnesota is the state in the United States that has been purported to have the highest rate of these diseases. There's a higher prevalence among Caucasians and Ashkenazic Jews, although as we're going along, there are more racial groups rising with these diseases, which is now starting to suggest much more of environmental factors playing a role, more so than the genetic influence. And if we're looking at the genes in inflammatory bowel disease, there's several different genes that we are thinking are contributing to this. And don't forget, our gut bacteria has been implicated in so many illnesses and conditions. Thus far, IBD is no exception because there is a dysfunctional mucosal immune response to the normal bacteria or commensal bacteria in this pathogenesis in IBD. So we're thinking that maybe even this could be a potential trigger, such as these bacteria playing a disruption in the mucosal barrier. Don't forget, we believe that the pathogens in the gut lining are not only these bacteria, but potentially fungi, parasites, and even energetic exposures to harmful EMF waves. So, for many sufferers, the exact trigger is quite difficult to identify because of so many insults and so many environmental toxicities that exist in our industrialized world. And in the US right now, we have pollutants with heavy metals, organic wastes, fertilizer, even cement dust and smoke that is in addition to all the EMF smog. So I think it's a fair statement to say that even a cumulative effect of these burdens can add up on the human body. Don't forget, even our food that we consume has been sprayed with pesticides and grown in minerally depleted soils. And of course, the processing that occurs afterward with our grains and our snacks and our cereals and this junk food that we have has such a very little nutritional content that I would say there's sometimes no nutritional content with these synthetic foods that we're eating. So this gut that we have, our intestinal tract, is a large area of our immunologic defense strategy. So it's weighing in, it's evaluating, and it's processing all of these compounds that we are ingesting in our gut. And its job is quite complicated because it needs to absorb those things that are nutrients and kick out and destroy and eliminate those toxic items which are harmful to us. And even stress has been purported to being a factor in Crohn's disease and inflammatory bowel disease, because imagine being in a constant battle zone in your gut distribution. Now, of course, there are certain medications that are purported to make the gut inflamed or leaky or causing these conditions, and anti-inflammatories, NSAIDs, are definitely in that category. So how do we go about diagnosing these conditions? And you actually need to get in and get a look into the small and large intestine, and that starts with the colonoscopy. And to the naked eye, in mild cases, it may just appear a little bit red, but even in the severe cases, there may be aphthe, which are these ulcerative pockets, or you may see frank bleeding in severely destroyed sections. Now, microscopically, when you get this colonoscopy for diagnostic purposes, the intestinal lining will get biopsied, and when we look at it under the microscope, we will notice that the microvilli, which is actually described as a shag carpet of these little microvilli, they are the absorptive surfaces that should be there in a normal intact lining. However, when it is severe in Crohn's disease or IBD, these microvilli are destroyed. They are no longer there, they no longer can work, and there is no ability for the absorption process to happen, and all of the billions of gut bacteria and yeast that are needed for survival in the gut, they also can't survive in that inflamed, bloody area. And if we need that gut microbiome to aid in our digestion and our immunity, no wonder we are left with an autoimmune and nutritionally deplete situation. And I propose that a normal, intact gut system with no toxicity and completely clean food will not attack itself. And that's the theory of autoimmunity. I believe an intact system will not attack itself. So, an integrative physician such as myself has the full array of diagnostics and treatments in the medical arsenal. So, please trust and believe there is a place for biologic agents and DMARDs, which are called disease-modifying anti-rheumatic drugs. If the intestinal tract is so severely affected with these ulcerations and bleeding and weight loss and cachexia, we need to bring the best dog to the fight. And I often coach patients that you would not bring a water pistol to a forest fire. So these pharmaceutical options can literally be life-saving, and when all else has failed and the patient is decompensating faster than any foundational approach is helping, they need to be used. And I'll just throw a few of the names of these medications out, which is Humira, Entyvio, Stelara, Cimzia, Tisabri. And there's some much older agents that will completely shut down the immune system that are less in favor but may be needed. And those are things such as steroids and methotrexate. So now after the severity has been determined and the medications are ruled in or ruled out of the equation, then we really need to add some of those functional pieces to help in the healing wheel. And some of the tactics I share, believe me, will take a lot of dedication, a lot of time, and persistence. The very first foundational piece always is the diet. And this is not very simple in an IBD patient. If there is a food allergy or intolerance, that must be ruled out as soon as we can, because that is a toxin to the gut. Try to get this evaluated as soon as you can. Now, timing could be important, because if the patient is on steroids or the gut is highly inflamed, the results can be skewed, but it is well worth the time and energy to figure this portion out. And sometimes the diet can be specifically catered not only to the patient's specific gut issues, but also specific to the patient's own personalized microbiome. Now, in a severe patient who is bleeding and losing weight, we may actually have to go with something that's called an elemental diet. And that is with liquid nutrients that are easily assimilated. So what happens is, it is a liquid formulation of the base amino acids, the fats, sugars, vitamins, and minerals. Now, it can be fed directly to an unaffected gut section, or might be needed in an IV or an intravenous format. For most of our patients, no matter what type of inflammatory bowel condition you may have, we need to eliminate some of the, or I should say, all of the processed foods, rancid oils, wheat, cow's milk, cruciferous vegetables. Now that's your broccoli and Brussels sprouts, cabbage and cauliflower. We must eliminate corn, yeast, tomatoes, citrus fruit, and eggs. Now, there are proponents of low sulfur containing diets, and that strategy would also need to stay away from beef and pork, eggs, cheese, milk, ice cream, mayonnaise, soy milk, and possibly even the nuts, the dried fruits, soda, and alcoholic beverages, because they contain the sulfites. So some of the carbohydrates that we could use in this diet are those that are easily assimilated, and that may include organic vegetables and rice and yams, but avoiding all of the grains and products made from grains. We may also need to avoid the legumes, potatoes, and lactose-containing dairy products. So the best nutrition will come from a well-balanced diet that is low in the bad rancid fats, low in sugars and animal protein, but high in the organic fruits and vegetables, fish, fiber, and omega-3s. And I know this sounds overwhelming, but with some calmness, the restoration of the gut can actually start in its healing process, and those bacteria can regenerate, weight can be maintained, and nutrients can be maintained. Now, let's get into the lifestyle pieces. For children and adults, let's get in some energetic work. Let's avoid smoking and alcoholic beverages. Common personality traits with the IBD sufferers include perfectionism and neuroses and something called alexithymia. And that's the inability to be emotionally aware or describe emotional experiences that are experienced by oneself. And by nature of this disease, with a strong gut-brain axis and mind-body connection, these patients are prone to depression. And because of that, these energetic and good lifestyle habits need to be incorporated on a daily basis. Find an energetic practitioner who understands the interplay between the biofield, the chakras, and influences of those energies on total body harmony. And that will help repair the gut, because we realize that this gut manifestation is part of the total mind, body, and spirit connection. Now, we want to think of some supplemental approaches, and there are some very good practitioners that believe that there is a deficiency component. So for the Crohn's patient, we want to make sure that there's a lot of folic acid, vitamin A is beta carotene, B12, vitamin C, and calcium, magnesium, selenium, chromium, and zinc. Now, when we're treating patients in the throes of the illness, these are higher doses that really need to be under a physician's supervision. Let's make sure we have B6 and vitamin D3. We also may want to consider probiotic influence, but caution, beware that prebiotics in the beginning phase of the illness may cause a lot of gas and bloating. Now, I believe as time goes on, as we can assess our own personal microbiome, we're going to be able to get a very specific probiotic combinations to go toward our own personal microbiome, but that is years in the future. Finally, we may want to consider some herbal approaches with frankincense, which is boswellia, curcumin, aloe vera gel, marshmallow, slippery elm, green tea, and mastic gum. So there you have it. Crohn's disease, ulcerative colitis, IBD, and a lot of these other gut-associated disorders are within our power to modulate and create remission. Seek a integrative physician such as myself, and until we meet again, be well.